The opium of the people. Opium was well enough known in the 1840s for Karl Marx to actually refer to religion as the opium of the people. Opium has been used since 5,000 years ago. Very common. But it was 1811 that morphine was actually identified. This really became popular, in the words popular, with the development of the hypodermic syringe and the US Civil War. But then we saw heroin discovered in the 1890s and marketed by Bayer Pharmaceuticals as a cough suppressant, oxycodone in the 1930s, and fentanyl in 1960s, commonly now administered both intravenously and as a transdermal patch. It was in the 1960s that the Single Convention of Narcotic Drugs was written by the United Nations to ensure access to these essential medicines under SGD3, and also to ensure that they were not misused and abused. It was around this time as well that a young nurse who became a physician, Cecily Saunders, discovered that the regular administration of morphine resulted in improved pain control in cancer patients. She established St. Christopher's Hospice and just recently has celebrated, would have been her 100th birthday, and it was prominent enough for Google to give her her own icon on the Google homepage. I had planned as a medical student to go and work with Dame Cecily, but I changed my mind, but still got to meet her in 2004 with my wife when I presented her with a Lifetime Achievement Award from the American Academy of Hospice and Palliative Medicine here in the United States. Instead of going to England, I ended up going to Calcutta to work with Mother Teresa in her home for the dying. And it was in actual fact, if you look at the pictures, where I met my wife, so almost 40 years ago. She was working with a nurse there at the time. Many people criticized Mother Teresa's home for the dying to say they didn't have inadequate pain, they had inadequate pain control. But in fact, India had inadequate pain control and continues to have inadequate pain control.
The woman named Fatima had a massive breast tumor, clearly infected and clearly painful.
She has severe pain. She can't sleep at night.
Fatima's family says she screams in agony day and night. But because of strict narcotics laws, morphine, the gold standard in pain treatment, is nearly impossible to get in most of India. So Dr. Dam is forced to improvise with readily available analgesics.
And this is not just a problem in countries like India. Here is an example from the Ukraine.
Here in Ukraine, some of the same bureaucratic hurdles that plague India mean that even a former decorated KGB colonel is left to die in pain. Artur Shumanov has stage 4 prostate cancer and is living out the end of his life alone and suffering. Has found his own way to numb his agony. And if it gets bad enough, Artur showed us his other plan to stop the pain.
This was not staged. This was a spontaneous action by this former KGB colonel, which was fortunate enough to be captured. Artur died some 3 months later, not at the hands of a gun, but because of his progressive disease. We can show this lack of access to opioids by different graphs, and we have here from the International Narcotic Control Board their reports of the different regions. You can see North America, but most of the rest of the world with almost little consumption. We here at the Walther Global Palliative Care Program actually get this data from the International Narcotic Control Board, and we get down to country level, and we look at Ukraine and India. India and Ukraine both now with less than 1 milligram per person per year of morphine equivalents available for pain control. But rather than graphs, It's actually often a figure that shows it best. Europe, probably the standard, but you can't identify most of the world because of the lack of access to opioids in this graph. North America and Australia being bloated. And this bloating, we keep being told, is actually due to the prescription of pain medicines here in the United States. But it's important we understand this. And if you actually look at the graph over here, you can actually see that most of the deaths here in Indiana are actually due to synthetic opioids and heroin and have little to do with prescribed opioids. But that's the message we continue to hear. There are actually states in the United States now where almost 100% of the deaths involve synthetic opioids like carfentanil and sufentanil, which are manufactured in Mexico and in China and imported here. In fact, there are some now over 100,000 opioid-related overdoses and deaths in the United States, increasing from 50,000 some 5 years ago. And that's despite the fact that the CDC had guidelines trying to restrict access to opioids, medical opioids. And they have actually restricted access to these, making it prohibitive for many cancer patients to get opioids. Just last week, the CDC proposed new guidelines where they'll actually be revising this. But this is a priority that we need to address. We need to address it and establish balance, not only for the Fatimas and the Arturas of the world, but for the people of Indiana. Thank you.